And now you should know, there is a sulcus running up and down the middle. And what kind of blood vessels are in this sulcus? What kind of arteries?
Coronary arteries?
Coronary arteries, exactly. Coronary arteries run in that sulcus. The one that runs down this way is the left. The one that runs off to the right side is the right. And then we've got a branch off the left one that runs inside. So this is the left anterior atrioventricular one that we learned about for the test. Okay? But we're just calling it the left coronary artery for the purpose of your practicum. So in the middle of the fatty area is the left coronary artery. Okay, and I've pinned right where you see the little blood vessel. And you can see why they would clog, right? Because look at the aorta and pulmonary trunk, how big these are, and look at the coronary arteries. That's why you see the disease in the heart usually before you see it other places, okay? Okay, that means everything over to this side is left. So left atrium, left ventricle, okay? And that would be the right atrium, right ventricle, okay? And I don't have a 34, which is okay because it's really hard to pin way deep down under like that, but that's the right atrium, okay? Right atrium, right ventricle, septum divides with the coronary arteries, left atrium, left ventricle. From the right atrium, you guys remember we have a blood vessel, right?
Is it like this?
Where does it go? Lungs, right? So this blood vessel here, this one right here, is going to the right side. It actually came from the right side and is leaving. It's an artery. It's called the pulmonary trunk, and it will go down around behind the heart and over to the lungs, carrying oxygen, no, deoxygenated blood, so carrying blue blood, right? Okay. The left side pushes blood out of a blood vessel just behind that. See how this is a blood vessel that's totally separate, just behind it has a branch? And then it goes like this. It's going to be a big arch and it's going to turn. That's the aorta. This little branch here is the brachiocephalic artery. You have a little star by the brachiocephalic artery because we don't ask that on the exam, because sometimes it's cut off and sometimes it's not. So it's hard to learn if it's cut off on your heart, okay? But that's the first little branch off the aorta. So this is the aorta, this one behind. And if you put a probe in here and go through, you'll be poking the left side of the heart because that's the left side ejects into that, okay? So you need to find your pulmonary trunk, your aorta. What are those numbers? Pulmonary trunk is 39. And your aorta is number 40.
38.
Oh,
38.
Thank you. 38. Okay. And we're not doing 40, 41, 42. And you find all these surface features. Then we're going to go and look inside the heart. And some of your hearts have been cut and some haven't. You can cut them if you want. It's fine. Okay? All right, but find those structures.